Welcome everyone to our special program today. Today, we will explore a very important topic not just for adults but for all of us. The changes to the Medicare program expected in 2025 and possibly beyond under the leadership of the Trump administration. To help you understand these changes better, I will make it easy to grasp and relatable, just like telling a story to children. Let's start with the first thing everyone will need to pay attention to: increases in Medicare Part B premiums. Imagine you are going out to buy pizza with your friends. Each person contributes money to buy a large pizza. Now, if the pizza shop owner decides that the price of this pizza has to go up because the ingredients have become more expensive, that means each of you will have to chip in more for that pizza. In the case of Medicare, the premium is like the money you have to pay to be able to eat healthcare services. For example, you used to pay $150 a month, but now you have to pay $185. This can make it much harder for people who have less money or don't earn much, just like when you have to pay extra to share a pizza, but don't have enough money in your pocket. Real-life example. Let's consider a senior named Mrs. Jane. Each month, she had to pay $150 for Medicare. Now, with the premium increased to $185, she feels worried because it's hard for her to cover her daily needs, like food and medicine. Mrs. Jane has to reevaluate her budget, similar to a child wondering if they have enough allowance to buy a toy. Next, we have another change. The number of insurance plans from which users can choose will be reduced. Imagine you are throwing a birthday party and you have a lot of different cake flavors to choose from. You can pick chocolate, vanilla, or strawberry cake. But now if the party planner decides to keep only chocolate cake on the menu, then you have no other choice but to eat chocolate. For Medicare, this means plans like Medicare Advantage and Part D will be cut down. Although the intention is to simplify things, this can potentially leave beneficiaries unable to find a plan that suits their needs. Back to Mrs. Jane. She used to have several plan options to choose from, each with different prices. Now, with just a few options left, she feels more confused and anxious. She remembers a time when she could pick a plan suited to her health needs without too much worry. Now, she feels like a child who has only one cake flavor left at a birthday party, and that's just not fun. Next up is a more positive change: the removal of the donut hole in Medicare Part D. Let's imagine you're playing a game, and there's an obstacle, a hole, that you need to get past. This game says you can only pass this hole if you put money into the game machine, and soon enough, you run out of money before reaching the big reward at the end of the game. In Medicare, the donut hole is like a gap that beneficiaries had to pay out of pocket for their medications during a certain time frame. After that, there's now a new cap. If you spend over $2,000 on medications each year, you won't have to pay more. Imagine Mrs. Jane facing difficulties in paying for her medications. She once felt anxious, unsure whether she would have enough money to buy her medicines throughout the entire year. But now that she knows if her medication costs reach a certain amount, she won't need to pay more. It's like winning a game after trying so hard to get past an obstacle. Next, we will discuss the expansion of mental health services. This is genuinely important, as people today face a lot of pressure in life. Picture having a balloon filled with air. When you feel sad or anxious, that balloon slowly deflates. If you don't have anyone to share your feelings or help you, the balloon might pop and you'll feel really sad. The new policies will support caregivers of the elderly and expand mental health services, so people don't have to feel alone when facing these challenges. If Mrs. Jane has a daughter named Lily, who cares for her, Lily also needs a place to relieve pressure and share her feelings. With the new services, Lily can seek support from professionals to manage her feelings and stress. This is like having a safe place to let the air out of her balloon so it doesn't burst. Finally, we should be prepared for potential changes that could happen in the future, starting from 2025. While we don't know for sure what will happen, think of it like a video game. At first, you have a simple level, but as you progress, more levels open up with new and exciting challenges. If new policies emerge in 2025, this could be an opportunity for us to improve the healthcare system and create more helpful ways to support everyone. We've just traveled together through the important changes that Medicare will face in the coming years. These changes are not just numbers or policies, but real stories of grandparents, parents, and people we love. Remember that every change has an impact on someone else's life. And with this information, we can better prepare for the future. Thank you for joining us today. If you have any questions or feel there's anything to discuss, please leave your comments below. We'll see you again in our next episode, and take care of yourselves. Wishing you all a wonderful day.